Dr. Shubro will take you through. So that's the plan. Please feel free to ask questions by typing it out in the chat box, and we will take it up. We will do that at the end, but we will appreciate your questions and we will be happy to answer them because that will clarify a lot of things. That purpose. Let's start. Why thesis? Now, obviously, think that we are in medicine and we are here to care for people who are not well and extend our skills people to make their lives better. But why exactly this thesis in the first place? Let me start with a very interesting quote by John F. Kennedy. People look at things and ask why. I look at things as they never were and ask why not. Now, whether it's why or why not, I would say that both these questions can be answered only if we have an inquisitive mind. We need to keep our mind in such a way that we could look at things, we could explore, we could answer, and we are always in a quest for excellence. And in healthcare, I'm sure that you will agree that we need to do that. So why this research and why thesis? In the first place, I'm sure that this statement will strike a chord and you will agree with me that medicine is not an exact science like many other, for example, physics, chemistry, or so many. So medicine, it's not 2 plus 2 is always 4. Every body behaves differently. So the same drug can behave differently in different people. The effects could be different. So it's not an exact science. And right now we are in an era of evidence-based medicine, EBM that we call, or rather evidence-based healthcare. So for the evidence to be generated, we obviously need to build up that evidence, and that will come only if we have the data. And where does the data come from? The data comes from whatever we do as research. When we start systematically documenting and then analyzing, that's nothing but research. And that will be part of our lives, whatever we do. So that has to be there. And so we are always in a constant quest for improvement. A case in point could be pandemic, the COVID pandemic itself. If you look at the start of the pandemic, we were clueless. We were grappling with the disease, and it was really creating so much of chaos, havoc, and a lot of loss of lives, morbidity. As we progressed, we started knowing a little more about it. We tried out different treatments. Of course, it's another matter, and some other time we can discuss. Some worked, some didn't, and there were a lot of ifs and buts and hues and cries, and I think things which didn't go right as well. But then now we have a better idea. So yes, if we did not go through these things and somebody did not document, and if you see COVID times, we've had n number of huge number of papers which have been published. That's all come from the research. So research helps us to lay this strong foundation so that we can appreciate the evidence. We are always in a quest for improvement, and we can see that how things can be better, whether it's a diagnosis or treatment, or you can say the prognosis or any other thing. So we are always, it could be a technique which we modify. It could be a treatment methodology, or it could be a new molecule, whatever it may be. Some of you might be desirous of an admission abroad, whether it for a higher learning, or maybe even sometimes some of you might be looking for prospects as career. So research helps us. It enriches your CV, and abroad they give a lot of emphasis on research. I'm sure that you will agree. A lot of people who aspire to go abroad and with similar credentials, somebody having research or publications in their biodata or CV, that has an upper hand, little more weightage. And whatever we may do, we would like to appreciate the literature. Now, let me tell you, when we are into practice as well, those of you who may be keenly interested in only patient care and practice or private practice or your own setups, you'll realize that more and more people who are from the pharma industry and what we know as the pharma rep or medical representatives, they nowadays are very smart. They come with literature. They say, sir, here is the new evidence. Now, we all know that nowadays literature can be of different types. Some of them could be even predatory or not so good evidence. So if I know how to separate the wheat from the chaff, and that would come only if I have some background in research. So I need to have some idea of the basics to understand the published literature. And if any of you want to be in academics, consultants, teachers who are there, they also have to guide. They have to guide the students, undergraduates, postgraduates, doctoral students. So if I do not have an idea, how do I guide? So I need to have some basic idea. And if I were to go into or advise someone to make policies, again, research gives me a better edge because I can very strongly and emphatically say that this works and this doesn't. And let's go by what works or what is the evidence. There have been multiple papers come out from editorials. What I'm showing you is again from Indian Journal of Ophthalmology. You see, this was why learn research methodology. And right in the first sentence, if you see at the first glance, this was written by Dr. Barun Kumar Nayak. So he said, most of us would assume that this editorial is only for those who are involved in research and is certainly not for me. However, we should realize that medical science is not an exact science like physics or many other, which I've already told you. And he goes on to say what is the benefit, and just to say that there has been a lot of debate on this, a lot of published literature as well. This is another one from Indian Journal of Pediatrics way back in September 2007, thesis during MD, must or bust. And the author goes on to say that this must be there. And this is again very long back, 1998. So it says case in favor of MDM is favor of ability to critically things like that. Please remember.
Dr. Animesh, I think we're not able to hear you properly. No, you are not audible.
Able to hear me now?
Yes, now we can.
Okay. Have I lost out on something? Have you lost out on something? Do you want me to go back, or I don't know how exactly?
Maybe just 10 seconds back. That's it.
All right. So yeah, as I said, these are various things. So a strong foundation. So those looking for greener pastures abroad, as well as to appreciate the literature, especially when it is coming to the literature, which even sometimes farmer representatives dole out, or new thing which come out when you are reading and then you want to adapt it for your patient care. And in academia, or maybe even if you are advising policy making. And as I said, there have been considerable amount of literature which has come out. I've just shared some of them. So all say that yes, dissertations or whatever like research, it should be a part and parcel. I also had written some time back that even in undergraduate curriculum, because I'm an advocate for that, that yes, there should be some amount of research. Now let me tell you that thesis is one of the ways where we can inculcate some basic aspects of research. Now you may have your points and you may say that in a busy clinical schedule, it's difficult. I agree, but we can tailor make it in such a way that we can create a balance. And we give a topic which is feasible, which can be done within the scope of the work that is there. Now, next question is, so having said that, okay, research, what should be my topic? How do I go about? Where do I get ideas from? And this is another question. So I'll not go into very specifics, and that I'll leave to Dr. Shubhro Jyoti, but I will just give you some of the tips which I thought will be worthwhile. So where do I get ideas from? So keep your mind open and search the medical literature. Think of the things that you are interested in, your guide is interested in, and discuss and look for the literature. Get some things and look for the lacunae. Sometimes there will be last section discussion. The limitations of our study were, try to get something out of there, and then you can probably address those. Attend scientific meetings, and from there itself you can get ideas. Discuss with your colleagues, mentors, not necessarily in your own field. Sometimes if you are, say, probably from, say, clinical medicine, and you are discussing with a pathologist, and you'll realize that something interesting comes up during the discussion, and they'll say that we've been seeing some tumors or something, and you will get an idea. Or you might discuss with a radiology colleague, and then you'll realize that there is an unusual finding, or they are seeing more of something which now is commonly seen, and you might want to know whether that's a true finding. And even simple thing like that could be, if it's not already there, or you want to add to the literature, whether it's happening in our part of the world. Sometimes some of the funding agencies will have their own research interests, and then that also could be, even as a student, as a postgraduate student, you are eligible to apply for ICMR thesis grants as well. Sometimes you might have done a small project, and then from that itself you get an idea and you want to expand that scope. So you could do that. Being a good observer itself sometimes gets you ideas for research, so that you can explore, being imaginative, keeping that inquisitive mind. And when you read papers in journals, always question, always try to reason out why, or why is this happening, why it's not the other way, and then you can probably come up with questions. So when you have a research question, keep this in mind, that a research question is very, very important. It's used to analyze and investigate a topic, and it's usually written as a question which is inquisitive in nature. And very importantly, a very important thing is that research questions should be properly laid out and made, and that's what is the crux of your research, because once you have a research question, that will determine how good is your research. So a properly written question usually will be very clear, concise. At the same time, you usually consists of these things: the topic, what the purpose of your study would be, the variables, if sometimes if you have the population also might be put up. So that's the idea. So how do you go about? Try finding an issue which interests you. It can be from your experience, from your reading, from something which intrigues you, from discussion with your mentor, colleagues, or the department itself is working on, and then you interest yourself into that. So you could do that. And then you decide what exactly you want to know in that, and what is that specific thing that you want to look into. And that specific thing should be turned into a query, a question. And then make sure that that question can be answered. It's a feasible thing, because it's a very important thing that it should be feasible, especially in your postgraduate DNB or MDMS research. It should be something which is answerable, which is feasible within the time duration, within the resources and other things that you have at your disposal. And check to see that your research question is neither too broad nor too narrow. These two extremes should be avoided. Of course, it will come with practice. Just giving you, and these are not postgraduate things, these are undergraduate things. Akash Ramaswamy was our MBBS student. Now, of course, he's a postgraduate elsewhere in another institution. So he had done this, and he wanted to, like, he was very keen on something about malaria, because we are in an endemic area, Mangalore. This was another student's project, that is Yamini and Chetan. Both of them were our students. They are both in the US now. So they wanted to know how exactly are we taking care of infection control in our hospitals, and then looked at that. So to sum up, research is very important in medical and health sciences. It definitely helps. It helps us in multiple ways: patient care, diagnosis, treatment protocol, so many ways. And it, of course, one of the pet subjects of my today's colleague and speaker, patient safety. So thesis is a very important method which can inculcate research methodology training, and definitely pave the way for somebody who wants to take it up further, or even in your practice, you want to document and come up with your own findings. So that can be one of the important steps. So with that, I'll stop here. Thank you so much. And for the next part, I would hand you over to Dr. Subhrajyoti. He will take you through how to write thesis. But before that, let me introduce Dr. Subhrajyoti. It's my pleasure to do so, who I have known for some time now and have had the pleasure of meeting as well. So Dr. Subhrajyoti Bhaumik, or Shubro as he is called, he had graduated from the Calcutta University with a gold medal in gynecology and obstetrics, completed his MD in pharmacology from the prestigious Institute of Postgraduate Medical Education and Research in Kolkata, and has currently 12 years plus experience in the field of clinical research, pharmacovigilance, and medication management in hospitals. Additionally, he has a certification in clinical research administration and project management from the Stanford University in US, and in patient safety from Johns Hopkins University in US. He's also completed a fellowship in healthcare quality from International Society of Quality in Healthcare, ISQA, from Ireland. And very importantly, I'm so proud to say this, that he is the first Indian doctor to be awarded the prestigious Lucian Leap Patient Safety Fellowship by ISQA for 2019. And during this fellowship, he also had the opportunity to worked in patient safety and risk management unit of the World Health Organization in Geneva for 3 months as a volunteer staff. And he has also been conferred the honorary lecturer position in the Institute of Clinical Science, University of Birmingham, UK, for his contribution to clinical research and healthcare quality. He is also an assessor for the NABH, and he assesses hospitals for medication safety and clinical quality standards. He's also a qualified NABH assessor for the Ethics Committee Accreditation Program in India. Not many people have that distinction. He also serves as the chairperson of Institutional Ethics Committee of Health Point Hospital in Kolkata and associated with 2 other hospital ethics committee as a member. He has a considerable experience in training and conducting workshops on clinical trial methodology, research ethics, evidence-based medicines, and biostatistics. Of course, he has a number of publications to his credit. He's also authored a chapter on regulation governing clinical trial in the book Fundamentals of Clinical Trial and Research. He's also been awarded the UK SATE Oration Award for Best Clinical Pharmacology Paper by the Indian Pharmacological Society in 2009. Also been awarded as the most promising healthcare professional in patient safety by the Asian African Chamber of Commerce and Industry in October 2018, and also been awarded Young Quality Achiever Award by Consortium of Accredited Healthcare Organizations India in 2019. He's on the editorial board of multiple journals and prestigious journal Drug Safety and peer reviewer for international journals like British Journal of Clinical Pharmacology and CNS Drugs. He's been invited as subject expert in pharmacology in the WHO-sponsored MBBS MD DM curriculum national review meeting. He's been a visiting faculty earlier and examiner for the clinical research and pharmacovigilance certificate course at Jadavpur University in India. He's also worked at Stanford University School of Medicine in US as a senior clinical research associate for 2.5, 3 years, 2015 to 17, and finished a certification in biostatistics, evidence-based medicine, and medical writing from Stanford University. He's been a visiting scholar at the Center for Patient Safety Research and Practice, Harvard Medical School in Boston, US, and he's a consultant digital health programs at the Maulana Abul Kalam Azad University of Technology, West Bengal, which is the state technological university. Currently, he is the clinical director of academics, medical quality and clinical research at the Peerless Hospital and BK Roy Research Center in Kolkata. So with that brief introduction, it's my privilege and honor to present to you Dr. Subhrajyoti Bhawmik, who's, as I said, fondly known as Shubhro. So over to you, Dr. Shubhro.
Thank you, Professor Jain, and thank you for that wonderful introduction. May I request, yes, so thank you for giving me the share option, and it makes my life easy to continue with the discussion after your wonderful presentation, where you have given a prelude on why research, in fact, theses should be conducted. At the outset, let me first thank Ovid from the Walter Kluwer's group for inviting me and Professor Jain here for this wonderful discussion of how to write DNB theses, because we as academicians believe that thesis writing is a very challenging job. And I want to congratulate not only Walter Kluwer's Ovid section, but also everybody who's attending today's session. I understand a lot of DNB students are attending. So let me tell you that as I pull my slides up, that it is very difficult. I've been given only, an hour's time to kind of speak on DNB theses writing, but let me tell you, it is actually every slide can be a session by itself. So, Dr. Jain, if you could let me know if my slides are visible.
Yes, they are.
Yes. Okay, great. Thank you very much. Thank you. So I currently work at Peerless Hospital and BK Roy Research Center in Kolkata as the clinical director for academics. And The reason I am speaking about this is because I work with at least 10 specialties which run at our hospital for DNB, and this is the nutshell which I have put together on what a good DNB thesis should be all about. So, what is a thesis? And I think Dr. Jain, Professor Jain clearly mentioned that it is a documented research work. But thesis is a written work resulting from original research. This is very important that it has to be original research, especially and the one which is submitted for higher degree in a university. So for the DNB students and the MD students, I'm sure MD and MS students are also a part of this group. So all of you are doing your thesis because it is part of your curriculum. All the universities in India, including the DNB, requires it that you complete dedicated hours of research or thesis work as an obligatory requirement for your PG training. And why is this required? Because a physician role, and I understand majority of you are clinicians, you is not only of seeing patients, but also there is a role of researcher. Because if you don't know how research is conducted in medical science, you will never be able to assess research. And as a result of which, the appraisal techniques, the utilization of new knowledge to improve clinical knowledge is practiced while we perform theses or we conduct theses during our PG days. Now, the first thing of thesis writing is selection of a very interesting thesis topic. Who decides? Guide or a student? This can go on, the discussion can go on, who will get to decide. But I think the decision should come as a consensus. Sometimes that is not the case. And that is the reason why some theses don't become very interesting. Because sometimes it might just be from the guides that they want to perform, they want you to ask on a certain topic, and sometimes the students are just not interested. So please discuss with your guides on what is it interesting topic. Topic selection is extremely important because I would tell my young colleagues here who are doing their DNBs, their MS, their MDs, never select an outdated work because you have to remain in this profession for more than 4 decades. Do something which is evolving. Do something which is time bound. Do something which is feasible. Your dissertation or your thesis is a reflection of your hands-on experience. Do something where you will be proud to show this case, to show this particular work to your students when they go and do their theses. We must avoid topics which do not give adequate and modern skills. Many of my students always say that we want to do easy topics, retrospective studies. Let me tell you, students, let me tell you, fellow colleagues, that easy topics can never give you big returns in the long run. One very important topic which we must keep in mind for every thesis is that institutional ethics committee approval must be in place before you embark on the journey of theses. Many a times this is not the case. Many a times in many institutions, the institutional ethics committee does not exist. Or even if they exist, the thesis work might have started, and then you remember, oh, I need to go to the institutional ethics committee. Please don't do that. All studies require clearance from institutional ethics committee. And let me tell you, many of the students tell me that are doing a questionnaire based study, we are doing a retrospective file analysis. Should we need an institutional ethics committee approval? The answer is yes, yes, and yes. In case of any confusion, go to the institutional ethics committee. If they want you to perform the institutional ethics committee review, of course the scientific committee is there, but the institutional ethics committee review, many times we have seen that the DNB will ask for this letter, and sometimes this letter, if it is not proper, the DNB is very stringent to send back the thesis. The questions you may ask when you have chosen a topic of your study is that what is the problem? What is the extent of this problem in your hospital? What is the relevance in your practice? What is the information, what is available, and what you hope to achieve at the end of your study? If you already have answers to all these questions, my simple tip to you is don't undertake that topic. Because if you know the answer of these questions, you need not undertake the topic, because thesis is nothing but a research journey over the next 1.5 years. A thesis should have the title page, the certificate with signatures, declaration by the postgraduate student, certificate of the ethics committee, acknowledgement and contents. What are the contents? A thesis should have a good introduction, the aims and objectives of your study. It must mention the review of literature. The materials and methods should be clearly depicted. The results should be mentioned. Discussion of the thesis should be crystal clear. Summary presentation, summary page must be present in the thesis. A conclusion page must be present, followed by bibliography or references. And ultimately, the most important thing is the annexures. The annexures are the various documents which were used during your thesis conduction in the last 2 years of your study, in the first 2 years of your studies. The cover is very important, and the first impression, it forms the first impression in front of the reviewer. The title should be clearly defined. The candidate's name should be present with the qualifying degree. Sometimes candidates who have done their diploma courses come to do the secondary DNB courses. So you must clearly define and clearly mention what is your degree. The name of the guides should be clearly mentioned, followed by their degrees. Many a times I have seen that the guides just name is mentioned and the department is mentioned. Please don't do it. Give adequate respect, because if you give respect, you will get respect. Name of your institution should be present, and the colors, usually we go ask the people to go for toned down colors like brown, black, or blue. They pick up different colors, but the cover page should not be very flashy. You must acknowledge people who have helped you during the thesis, and this is a very important page, who have helped you in writing your thesis. They could be many other people who are not your guides or co-guides. They could be the committee members, they could be lab people, statistical analysis plan. Let me tell you, the statisticians are the most important people whom you have to contact from the beginning of the study. The general concept is we need to contact them at the end of the study to have a statistically significant P. That is a very, very wrong concept. People who have helped you for any kind of funding, if you have received a funding for your research, for your DNB thesis, you must mention that. And optional is definitely dedicating it to the family and friends. The first section is introduction, and this sets the ball rolling. It gives a description of the general problem of the statement, of a specific problem, and why you were motivated to do this study. So it starts that what is exactly the current scenario and what was missing, and that resulted in the starting of your topic. In this introduction, we need to mention what we know about the topic. Also, we need to mention what we don't know about the topic, which is also known as the knowledge gap, and what we embark on, what we are planning to embark on the journey. It should be clear, summarizing what's known, what needs to be learned, and what our research paper aims to accomplish. There could be different paragraphs which might define the relevance of the problem. The second paragraph may talk about the unclear issues, and the last paragraph may talk about the main objective or the purpose of the study. This is from one of our students whose thesis was accepted last year. And this is the introduction. If you look, this is from an orthopedic surgery background. This thesis was submitted to the DNB for DNB orthopedic surgery, and this student has passed DNB orthopedics now, and he is a consultant in one of the hospitals in the city of Kolkata. And if you clearly see that he mentions his study was on diaphyseal fractures, and he clearly mentions about which bones are affected by the diaphyseal fractures, what is the percentage, and what is the problem statement, and what he wants to embark on. The next very important section is the review of literature. In fact, the review of literature gives you the introduction, but while you are writing the thesis, the introduction part comes first. The review of literature talks about what is known on the topic, what we don't know, and why we want to do this particular study. The review of literature is conducted from the traditional texts, from publications, from journals, from books, and they must be clearly documented. There are various indices. There are various search engines which can help you in review of literature. I would like to mention the PubMed and Medline, the academic search by Eberhorst, the annual reviews, and the Science Citation Index. You can also look at Google Scholar. I would request Ovid to actually undertake one session on how to conduct review of literature, because in the paucity of time we cannot just go into details. If you PubMed can actually give you wonderful results on how you can search on particular topic, and that topic can be kept in the repository for a long period of time. So this is the review of literature from the same orthopedic surgery theses which mentioned about. See how beautifully the review of literature begins from the early 1600 BC, before Christ, till the modern times. What has been known on this topic, how this disease was managed in the early before Christ era, then how the evolution of the treatment process has taken place is written in the review of literature. And this you need to do with respect to your particular topic. You need to thoroughly do the review of literature, to search the literature and put it down in a sequence. One of the commonest mistakes students do is the review of literature is not very structured. So if you give a review, it should be either, the best method is starting from the oldest to the newest. Sometimes I have seen they will cite a paper from 1970, then they go to 1995, again they come back to 1983, then they go back to 2000. That is not what the reviewers like when they see it in the DNB board. Research objectives, another very important aspect of your thesis. Each study, my students, they must have one primary objective. Many of our students at Peerless Hospital, Kolkata, which has been doing DNB program for the last 20 years, I must tell you, many of their theses have come back where they have given multiple objectives as their primary objective. Let me tell you, and let me put this in your brain, that whenever you are doing one thesis or a research or a man or or a plain research, you cannot have multiple primary objective. It has to be a single primary objective. There can be multiple secondary objectives. I'm sorry, there is a mistake here. There could be multiple secondary objectives, and the sample size must be calculated on the basis of primary objective. So if you look at this one, so aim is the overarching concept of the study, but the primary objective is one and the secondary objectives are multiple. So many people get confused between aim and objectives. Aim is right now, your aim is to attend this workshop or this training by Ovid. But how have you achieved this aim? Many of you have logged in through the mobile phone. Many of you have logged in through your laptop. Many of you might have logged in some by other mechanism. So your objective can be different, but your aim is one, which is to listen to this particular work seminar or the webinar. So primary objective is the one which aligns to the aim the most. And there could be other objectives which are known as secondary objectives, which defines the aim of your study. So the aim is an overarching arm. It is an overarching concept. Materials and methods section is extremely important because it provides detailed methodology which is used to conduct the study. Where it must provide sufficient details and what has been done in the study. The inclusion exclusion criteria should be properly defined. If you are taking a control group, you should describe that. And we must also, for observational studies, we use different structures. So strobe diagrams have to be used for observational studies. Consort diagrams are used for clinical trials. It's not a time to discuss this in details, but if anybody is interested, we can always discuss offline. And again, I would request Ovid to conduct series on how to write research methodology, how to conduct research methodology. This can be a webinar in itself. This is an example of that student on how he wrote the materials and methods. He mentioned about the study area, the study period. He mentioned about the sample size, the study population. He mentioned about the sample design and the patient selection, inclusion, exclusion criteria, and this has been accepted this has been accepted by the DNB board. Then we come to results. This is the main section which should be very concise. It should contain tables, graphs, and should depict what was found in the research which you conducted. And there should not be duplication of information between the graphs and the tables. We need to be very careful. And I think a good tip here is to talk to your biostatistician, because they know really what is the best method to showcase your results. They will tell you the best possible tool, the best possible graph, the best possible table on how this should be, that results should be mentioned. The tables should always be numbered in Arabic numericals. Each table should have a comprehensive heading. This is extremely important that the tables should have their fixed font size, usually size 12, and each table should indicate significant changes with asterisks. The level of significance must be mentioned in each table. This is another very common thing which I have seen, that the DNB sends back the theses, that if you have done analysis on the primary objective and you have not written the statistically significant significance in that particular table, then DNB is going to send back your thesis, is not going to accept your thesis. So this is the example from the student whose thesis was accepted in orthopedic surgery. And if you can see in this table, very clearly mentioned that, between age and the final outcome, if there is a correlation or not, and the p-value has come to be very significant, and that has been clearly mentioned in this table. Figures should not duplicate tables, and they are also to be numbered in Arabic numericals. And figures are important for depicting important data, and particularly, I would say, categorical data. Coming to the discussion part, it's a very, very important section of the thesis in DNB or MDMS. It should uh, depict the positive results. Now, many times what we see is that the results, the people try to copy paste whatever is there in the results in the discussion section. Don't do that. The discussion section should contain the important results, and the important results should also compare them with the similar results found with previous studies. So if the similar study was, suppose the study is conducted in Kolkata, and we have a similar study in Bangalore. So what were the similarities between the Kolkata and the Bangalore study? We need to clearly define. And what were the dissimilarities? That also needs to be defined in the discussion part. Another very important aspect of discussion is to mention the weakness of your study. Every study has weakness, whether it is bias, whether it is time limited, whether it is unicentric. So you have to mention what is the weakness of the study. If you keep on mentioning my study is the best study on earth, that people are not going to accept. You also must only not harp on your weaknesses, because then your study definitely does not go through with the reviewers at the DNB board. You must highlight the adequate strengths of your study as well. The discussion section can also actually have, if you want to compare it with the previous studies. So this is the example which was done by our student, where he found that in the mean age of the presentation of his patients were 39.1 years, whereas the other studies done maybe 20 years back, it was 32 years. So it was more younger in that. So this is another methodology in which you can mention the similarity or the dissimilarity with the studies which have been done in the same domain. The summary the summary sheet or the summary page is a very, very important page, because many reviewers actually read this section first before they start reading the entire thesis. This section should ideally stand alone. If anyone reads it, it should know why the study was done, what was found. It should include the background in 1 or 2 sentences, the aims, the methods, the results, the implications, the drawbacks, and definitely the directions of the future research. So this is the summary section, page number 65 of his thesis, and this clearly mentions what happened in his DNB thesis. He mentioned about how many patients were included, what was the age, what was the sex predisposition, why these patients, which type of trauma resulted in this fracture, how these patients were managed, and what is the take home message in his study. So this is a very important page, or very important section which must be present in your thesis. But beyond that, we have conclusion, and these are brief generalized statements to answer the general and each of the specific sub problems. They contain generalized in relation to population, and extremely important that the conclusions have to be in a way that you always conclude with the help of statistical analysis. You have to have one-to-one conclusion. Sometimes one-to-one conclusion is possible, but sometimes a overall conclusion may be required by using a zoom lens approach. So the conclusion requires, you also have to build up the conclusion on why this conclusion is coming up to you, how the analysis has revealed what and what came to you and how it came to you. So if you read this conclusion from the student, it mentions the last paragraph, and I quote, with correct anatomical knowledge, preoperative planning, and good surgical techniques and postoperative rehabilitation, antegrade interlocking in humeral nailing is a viable option in the management of fracture shaft humerus, promising an excellent outcome. We hope that in days to come, through continued medical research, further refinement in nail designs and surgical techniques, is possible, offering mankind a better quality of life. So I think you also leave hope of future research in conclusion, whereas in summary, you only limit yourself to what you found in your study. And so this is the basic difference between the conclusion as a whole and summary as a whole. Now, there are certain annexures which have to go with a DNB thesis, and many a times, if they are not submitted, the thesis will come back. One is definitely your case record forms, but beyond that, the Gantt chart. This is a chart in which series of horizontal lines shows the amount of work done or production completed in certain periods of time with relation to the amount of plan for those periods. So it actually talks about what data was collected, what was exactly, how it was collected, in what time duration it was collected, and how it was analyzed. So the Gantt chart for theses actually is the most important annexure. If you don't give any annexure, but this has to go in the DNB thesis. Along with this, you have to give your informed consent forms, you have to give your case report forms, but the Gantt chart for theses has to be there in your thesis for submission. So an ideal time management is extremely important, and it requires a plan of action. I think a draft proposal should be ready for within the first 3 months, and it should go to the scientific committee and the ethics committee approval in the first 3 months. Quarterly progress report we must generate with the guide, because the guides, as I understand, many of the DNB training institutions are private institutions in the country. Some of the consultants are very busy, but I would say the DNB students should generate a quarterly progress report at 6 months, and they must give this report to the head of the institution or the head of the academics, as well as with the institutional ethics committee, to the institutional ethics committee as well, if the requirement comes in. The preliminary protocol with Gantt chart should be there for every 3 months. The final draft dissertation should be ready 7 months before exam. And the final dissertation, as we know, the DNB wants us to be submitted 6 months before the exam. So we need to have our milestones or the timelines very fixed. Otherwise, you are going to be very stressed out in the last few months if you have not planned it properly. The last section, of course, is bibliography, which talks about the list of sources to get information and includes, you must keep track of every book, every encyclopedia, every article you read. You must record it in your computers. And let me tell you that Vancouver style of referencing is the preferred style of referencing of bibliography by the DNB. And if you don't do it, let me tell you that this is going to create serious problem, because I have seen personally in my experience with my students that the DNB is very, very ruthless, if I could use the word, and strict. It sends back theses. Everything is proper, but the Vancouver style of referencing is not proper. The DNB theses will be back for correction. We don't want the DNB theses to come back to us. So you must learn how the Vancouver referencing happens for books which have been published. So this is an example where books has been taken as citation in Vancouver styling, where different journals have been utilized. So please follow the Vancouver referencing styling when you are writing your references or bibliography. An ideal thesis, according to me, should have sound stuff. So if you have done a study which has already got foregone conclusion, that means does internal, for example, does antibiotic help pneumonia? We know that if there is pneumonia, antibiotics are going to help. That kind of thesis will make no benefit. So you must have a sound stuff, a scientific sound thesis. It should be well written. It should be well presented. English should be really, really crisp. And sometimes if you can't do it, there is help available. You must seek help. It must be accurate and it must be complete. Now let me tell you, what are the theses reviewers looking for when they get your theses at the DNB board? And this slide I have prepared on basis of my experience of what resulted in the theses to come back to Peerless Hospital. Because we've been doing this for the last so many years, a decade, I would say. I think one of the things which the reviewers look for is, number one is if your review of literature is complete or not. So if your thesis is due this year in 2022 and you have not done the review of literature for the last 5 years, to be precise, the thesis is coming back. I mean, something is published in 2022 January and you have missed this, that's not going to help you. The literature has to be relevant, it has to be critical, and not just descriptive. That means you have only taken the positive findings because you have worked on a positive finding. It's not going to work for the reviewers, because the negative findings also, if there are studies which have given negative findings, if they are not included in the review of literature, then the reviewers are not going to take it very easily. Is it comprehensive? Sometimes I've seen review of literature written for 30 pages. It's not going to work. Definitely is not going to work. So make it comprehensive, link it to the methodology in the thesis, and please summarize the essential aspects. Don't pull in everything and anything which you have searched down in while you are doing your thesis. The methodology section is another section. If it is weak, then you are really in a trouble, because if you don't have a clear hypothesis, then the reviewers are not going to take it easily. And another thing which they have asked again and again is, if there is a comparator study, which we do many a times in our institute, what is the bias? No, I'm sorry, what is the precaution we have taken for bias? If randomization has been used, and how randomization was performed, if blinding was used and how blinding was performed. How were the limitations identified? How was the data collected? Now, many a times we just mentioned the data was collected retrospectively. That does not yield any information. Please clearly specify how the data was collected retrospectively, that it was done by you going through the medical records from this to this date, and the medical records were electronic or they were paper records. How did you get an access? So exact methodology has to be there, and the methodology has to be justified. Another section from where the reviewers are very strict is that the presentation of the results. If you have multiple charts and multiple tables and many of them are duplicate of each other, then be sure your thesis is coming back. The hypothesis has to be tested. This is very important, and the hypothesis has to be presented. The data has to be properly analyzed, and you need a biostatistician or a person who needs biostatistics, who knows biostatistics, to help you out. You don't need, I told you again and again that the primary objective has to be analyzed in the proper way. You have analyzed everything, but you have not analyzed your primary objective, or you have not represented your primary objective in a proper way, then it is not going to help you. The results have to be clearly presented, they have to be identified and summarized. The discussion and conclusion sections are equally important. You have to identify limitations of your research. If this section is missing, trust me, your thesis is coming back. You have to identify limits of your research or your thesis. What were the main points which emerged after your study? What links have you made to the literature? Is there a theoretical development? And are the speculation well grounded? So if you speculate a lot, be sure that you have evidence to speculate. So to summarize my presentation, I would say DNB thesis writing requires a lot of plan of action, and this is true for MD and MS thesis writing as well. Selection of an interesting topic and working on the review of literature is the first block, is the first initiation. If this goes correctly or this goes right, then trust me, students, you are on the right path. Study synopsis must be approved by the institutional scientific and ethics committee before you embark on your journey of theses. Please don't do your theses if these two institutional bodies have not approved your study synopsis. Objectives must be clear, one primary followed by multiple secondary, and the results have to be properly documented. Discussion must specify the strengths and weakness of your research, and the summary page is a must page because it gives a snapshot of your work. If this page is missing, trust me, your thesis is not going to be accepted by the DNB board. Conclusion must be clear and must specify future direction of work. So because you are doing this particular work, and no work, as Professor Jain was mentioning, as medicine is never complete, is never objective, it is always subjective. So no work is ever complete, no research work is ever complete. You must specify future direction of your work so that you can defend your thesis during your examination as confidently as this guy, because we want you to do that. And I must tell you that if you undertake these small tips of doing a right introduction, having the proper aims and objectives, writing and depicting your results properly, and writing a proper discussion followed by the summary and conclusion and referencing, your thesis is going to be the concise and completed thesis, and it will be accepted by the DNB and of course by your PG university wherever you are doing your MD and MS program. With this, I think if there are questions, me and Professor Jain can take the questions. I don't want to, kind of elongate with a lot of slides, but if there are questions, if you have any questions, I'll be happy to answer those questions directly.
Am I audible?
Yes, you are.
Okay, so Dr. Shubhra, we've just got a question from Dr. Niranjan Kadlur. Can we change the sample size after submitting the protocol?
Yes,
This,
you
I think, has
can,
been
but
sent personally to me, but yeah.
but I wanted to understand more about this. What are you talk? What do you mean by submitting the proto synopsis to DNB, right? Is that what he's mentioning?
I think so, because it's not mentioned here. That's what
Yeah,
I understand.
yeah.
So
I
that's
think
what is
yeah.
written.
The
Can we change the
answer to
sample size
this,
after submitting? Yes.
the answer to this is yes, because my first thing I will tell the doctor is that better not to change. I mean, you must have embarked on some statistical analysis plan, and you must involve your biostatistician or a community medicine expert or a person who knows biostatistics from the beginning. This is one mistake which we don't do. We always think that the biostatistician will come in the last like a hero and save the movie. It is not going to happen. The movie will be only saved if you involve the hero from the beginning. So the statisticians are the hero of this particular thesis topic. The sample size calculated wrongly, will not result in number one, a good thesis, number two, a good thesis viva, number three, a good publication. I mean, you're putting in so much effort, and I think India, one of the major drawbacks of the Indian doctors is that they don't publish. They do so much of work, but they don't publish. I would always say that yes, you can always change, but it requires a to and fro communication with the DNB board. You have to inform the DNB board on the reasons on why you are changing. So better be careful before you initially submit the synopsis. Scientific committee, I think, has a very important role here to play. And a statistician must be a part of the scientific committee, and he must take care of this.
True, and I second that. And again, there must be some kind of valid reason why exactly you're changing. There has to be some reason, because when we have submitted the protocol or the synopsis, as it's called, so they would have taken into account the advice from statistician and considered all the facts. So I think we can't just change it like that. But if there is a valid reason, you'll have to, and then you'll also have to. I would suggest that you'll also have to go and inform your scientific committee, ethics committee. There's a next question I will take up, Dr. Shubhro. This comes from Dr. Shailesh Ramesh. If planned questionnaire lacks expected information, can it be modified during the study if it is not getting the information that is required?
So I will rather ask Dr. Ramesh, why have you selected that questionnaire if it lacks the expected info? I mean, we need to do some hard work, Dr. Ramesh, and you've done remarkable hard work to select this questionnaire. Let's ask this question: what are we trying to embark and by using this questionnaire? Ideally, if you there are two ways of using questionnaire. One is, of course, you use a validated questionnaire. So there is no question of changing a validated questionnaire during the course of the study, because it will have far-flung ramification with respect to the analysis and the outcome. So that question does not arise. The second way of using a questionnaire is to develop a questionnaire and to validate it. And when you validate it, then that is done before you submit the synopsis. So validation has to be done before you submit the synopsis to the NBE board. Okay. So if you don't do it while the validation has completed and you hurriedly submit it to the NBE board, let me tell you, Dr. Ramesh, it is very difficult. I mean, it's not that you cannot change, but there are thousands of NBE students across the country, and for them, you are just a roll number. For us, NB is the most important degree we want. So I think we need to be very careful, like as we want to be with our MD theses or MS theses, we need to be very careful when we have, it was a preformed standard questionnaire, but needed more info when compared to other studies. I think if I would be you, I would stick to this preformed standard questionnaire and conduct this study right now, because if I change it, then this will require validation again. And you have to, the reviewers are going to ask you, how did you validate this new questionnaire? Because it will no longer be a preformed standard questionnaire. It becomes a quote unquote new questionnaire. And every new questionnaire has to be validated. I think Professor Jain will definitely echo my thoughts, because you have to understand, Dr. Ramesh and others here, we don't expect you to be research experts. We expect you to know the steps of research in the proper way. So here the question is that what the results are coming are not important. Don't come with a mindset that P has to be statistically significant. Your study might not show any significance. That is the important part of the study. But if you have done it properly, if the methodology is correct, if the analysis is correct, that is what the examiners or the reviewers are looking. The examiners will question you during your exams, and the reviewers, of course, during your initial part when the thesis is accepted, will review that. So I personally will say it's a very dangerous proposition to change a standard questionnaire during the course of study. I will not do it, and it's better not to do it. And at all, if you want to do it, the answer is you can do it, but it will require a to and fro, a lot of communication with New Delhi. Yeah.
Yeah, Dr.
And
Animesh,
yeah. You muted. Yes. হুম। এটা শেষ হলে 8 o'clock যাবে। আমি কথা বলে যাবো। আমি কথা বলে
so
তারপরে
you
যাবো।
are not audible, Dr. Animesh.
Now,
Yes, you are.
Okay, so there are 2-3 questions on retrospective study. They want to know, will DNB board, that is NBE, accept the retrospective study, or can thesis be
Absolutely.
retrospective?
Absolutely. The answer to this is absolutely yes, yes, yes. DNB has never said that you have to include only prospective study. Again, let me tell you very clearly, studies methodology has to be correct. It cannot be that I started a retrospective study and I thought, oh my God, numbers are less now. Now let me go ahead in the next 6 months, I will do another prospective arm. So you cannot do any khichdi study. There is nothing like a khichdi study. Either you do a prospective study or you do a retrospective study, and 100% retrospective studies are acceptable.
Dr. Shubhru, as I understand, I think recently there has been some some kind of a directive from the NB board. I think they are not allowing retrospective. If I would
See,
be
I am not updated, so it must be very recent. When is this? When
yes,
it has come?
I think
Has
within the last 2 years. I think within a year or last 2 years,
no, because
because
our students in medicine, our students in orthopedic surgery, in our institute, which where we are running these courses for pretty long time, they have submitted retrospective synopsis and all have been accepted.
true, but I think recently because they've had issues, some 2-3 places, some of the
Mhm.
places like they've had issues, as I am aware. So I think that, and this was a discussion elsewhere also in some of the places where I have spoken to DNB residents, and uh, I think this discussion came up. I think recently there has been a change. Even I've heard
Okay,
from
so
somebody.
maybe I am not updated on this because I am talking about 2021. 2022 synopses are going right now. And 2021, to the best of my understanding, we have retrospective studies from residents in medicine, from residents in orthopedic surgery, and none of these residents have come back to us saying that DNB has not accepted their retrospective studies. I will definitely ask the residents or the students who are attending today to check with the NB website if there's some which has come out. But I don't understand why a retrospective study will not be allowed if the ethics committee and the scientific committee approves it. So to the best of my understanding, as I mentioned, and I'm quoting my students in 2021, 2022 has still not been submitted. Some of them definitely had retrospective study because I've guided them. So I know that.
No, maybe, but as you said, and I've also looked at the DNB board, but I didn't find any guidelines like that. Even I tried, even I think 3-4 days back, I couldn't find. I will also check.
Yeah,
So,
so what I can do is because I keep on talking to the NBE board, I will get the information. I'll share with Ramya. And Ramya, if you have email IDs of all the participants today, you can send that information to them. But to the best of my understanding, it is I have not received it yet. So we can look for it.
true, because in April also, when I was doing a session with one of the Sankara group of hospital DNB students, this came
Yes,
up. So
yes.
that's why I have not found, as I said, but then probably there is a recent change, something like that. Anyway, so as of now, like we are not very certain, but as Dr. Supro said, that earlier it was accepted. Maybe something to do with methodology. We'll have to probably go into the depth of this issue, probably. Uh, One more question is, I'm doing my DNB in cardiac anesthesia. Can I do a study that will include both retrospective and prospective? I think you've answered that question. So,
I think you are the best person to answer this, Dr. Jain.
yeah, actually, no, I don't mind answering, but I would need to know why exactly somebody wants to do both. Okay, there has to be the research question will dictate that. So I don't know. I mean, if it's just like this, I'm not sure what exactly is the purpose and why exactly somebody wants to do that. I think Dr. Maitri has asked that.
No,
So I'm
see,
not sure.
Dr. Maitri, I can tell you the reason why she is doing it because her cases must be very limited. She probably has some cases in the past and she wants to continue it with the future. So let me tell you, Dr. Maitri, I'll give you a good news. So it is actually accepted, frankly speaking. Uh, uh, we have experience in our institute in orthopedic surgery. I will name that specialty where this kind of a design is accepted, where you take some from the past and some from the future. I mean, prospective. So this is accepted by the NBE. So this is actually, I've seen the thesis getting accepted. So yes, you can do it. There's another question from Dr. Debojyoti Kaur. You can take that question. Can theses
Yes.
be retrospective? I think my answer will be yes. The theses will be retrospective, though we need to check. And I personally would say that if the NBE website does not say no, then we should stick to it, because here and say evidences don't work with NBE. NBE is a very crystal clear organization, and they have all their updated notices on the website. And in fact, if something like that would have happened, I can tell you it sends regular emails to all the institutional heads. The one virtue of my position, I get those emails. And I'll share one example, that institutional ethics committee approval is now important, but institutional ethics committee, where whoever is running the DNB curriculum, those institutional ethics committee have to be registered with the Department of Health Research. So for the students who are attending today, please go and check with your institutional ethics committee people whether they have got registered with the Department of Health Research in New Delhi, because that is a mandatory requirement which has come from NBE in the year 2021. So we are registered at PLS, we are actually registered, but many of the institutes are not even aware where the Department of Health Research exists. So if they are not, this might create a problem while your thesis is being submitted for final submission. So that is what the DNB has sent, a very clear-cut guideline, clear-cut dictum, or a clear-cut, I would say, direction to all the head of the institution that you better get registered not only with the DCGI but also get registered with the Department of Health Research in New Delhi under the ICMR. So Dr. Himanshu is asking, can secondary objectives be added during the study? Dr. Himanshu, the answer to this is yes, they can be, but ideally it is better that you don't change your primary objective. You can add secondary objectives because you will get a large data set. But again, let me tell you to all the students that please very clearly have your primary hypothesis defined. Because if you don't have a primary hypothesis defined, you will find it very difficult to come to a conclusion, because ultimately you need a conclusion. So answer to your question, Dr. Himanshu, answer is yes, you can add secondary objectives during the study.
Yes, the other thing is what you rightly said, Dr. Shubhro. Actually, even in Ophthal, I know that there has been the retro and prospective combination done. Okay, and they are accepted. So to answer that, but again, it will depend on what is your objective, what is the reason, and what is the. I mean, we don't always do that. As you rightly said, Dr. Maitri, that you're doing a particular study which is on pulmonary thrombectomy, and then that's why you have very few cases. I think no other questions I can see right now.
There are no questions. If there are any questions, you can always write to both of us. We are always there to help you. And of course, Ovid is there to help you out. And I would request Ramya that we can have this is just a curtain raiser on how DNB theses can be written, because it requires a lot of planning, and every slide which I showed, starting from the introduction to the bibliography, it requires in-depth study and analysis and in-depth knowledge. That is extremely important. But let me tell you, this is a very interesting journey, and to all the people who are attending here, please publish your theses. Please publish your theses, because that can be your first publication, maybe one of your best publications.
Dr. Shubhro, three questions have just come up. One is from Dr. Rajiv Kumar. What sequence one should follow to write thesis? Is it from introduction to conclusion to references, or any order can be followed and arranged in sequence as per the prescribed structure?
Okay, so What sequence should one follow to write thesis? Is there introduction, conclusion, reference, or any order? No, I don't think so, Dr. Kumar. That is the right thing to follow any order. You have to have a defined order. Like, I don't know which specialty you come from. If you are a surgeon, then you will definitely cut open. First, you will do asepsis, then you will cut open the skin, then the fascia, and then the muscle, and then go inside the in the organ. You cannot just cut open anything and go inside. So we have to follow. We have to have introduction followed by, as I mentioned, of
No,
review of literature.
Dr. Shubhra, what he's saying is, shall I, like, see, I write different things, then I'll put it together in one sequence. That's what I mean.
Yeah, so
From
I personally, for me, I would say that collection of the data is the most important thing. If I would be a student, I would first finalize my primary objective, primary hypothesis, and then design my case report form to collect my data. And once the data has been analyzed, and I know that the data, the result section is the first one to develop actually. So the result section will develop first, and you can write the result section. And depending on the result section, you can write the discussion, because that's where the most important, matching and mismatching of results with other studies happen. But let me tell you, when by the time you write your discussion, your review of literature must have finished, because while these two will happen side by side, when you write your discussion, then you have to compare what is similar studies, what are similar studies, and what are dissimilar studies. So the review of literature will also develop subsequently, and some portion of review of literature will eventually go on to become the introduction of your thesis. So I think this is the sequence. I'm sorry I got your question wrongly. So if you ask me which is the first section to develop, the answer is results. The results are the first section to develop. Uh, there's so Dr. Maitri, okay, she said that can we include and elaborate about studies that were found to be against our hypothesis? Yes, Dr. Maitri, you have to include and elaborate about studies which were against your hypothesis. Let me tell you, I have with my experience in the last 10 years with the DNB board, I am telling you again and again that if you only write positive, also with the MD, there are certain, because I am also an MD thesis examiner. Professor Jain is an MD thesis examiner. When we have a checklist, MD thesis, when we are given a checklist, if we only see positive studies and there is no negative studies which have been calculated, it is a kind of a bias in literature review. You are biased in literature review, so it is not going to be accepted. And please evaluate, please do that. Please do that. Again, Dr. Ramesh is asking, can socioeconomic status be calculated with occupation alone? Very difficult question. I think the answer is no.
no,
Socioeconomic, yeah, it is absolutely no. Socioeconomic is with the help of, I think there are multiple factors with results of, you can also
no.
look at what
If
is,
you had asked me, no, if you had asked me only by income, I would have said yes, because there's one
yes,
scale, BG Prasad. But only occupation, to my best of my knowledge, no. There are
no,
different scales. Just to give you quick answer, that just socioeconomic status to calculate with the occupation, I don't think so. Maybe income, yes. Otherwise, income, occupation, and education, that is the Kupuswamy, and there are different
yes.
scales as well.
And let me tell you, students or the colleagues who are attending, you have to keep discussing this over a period of time. It's not that the last 1 month where you get totally crazy that we have to do our thesis in some way over a period of time, because this is a good learning experience. Some of you will eventually join private hospitals or maybe government hospitals and become teachers, and so you will have to guide future postgraduate trained students as well. So uh, please keep learning. I would say please keep learning as you keep doing it as well. I think there's one more question, if I'm not wrong. For literature review to be comprehensive, what will be the appropriate word limit? That is a very good question. Under what subheading should we should we proceed? See, literature review, I think there is nothing called a minimum literature review word limit or a maximum literature word limit, to the best of my understanding. The literature review is basically, it should be adequate. You must ensure that you have included the recent most literature. So you must have searched PubMed, Google Scholar for the recent most literature. People are not concerned if you have missed 2019 publication, but people are concerned if there is a newest publication in January 2022 and you have missed it. So that's how the reviewers, because reviewers will do that kind of a search as well. So I would say then a good literature review would be somewhere between 10 to 15 pages on an average, with where it completely has details of, as I showed you the example of the very first occurrence of that particular disease or management, where how it happened in the prehistoric age and how the sequences improved, because this is the portion which shows how much in-depth analysis you have done about your topic. But again, last 5 years, this is what I personally believe, the last 5 years literature search has to be complete. You, whether it is Indian literature or it is Western literature, you cannot miss, whether it is positive studies, whether they are negative studies on your topic, you cannot miss about that.
And in fact, DNB board says 10 to 12 pages, I mean, just gives a guideline for review of literature, but of course, it can vary a little slight here and there. And I think previously also, Dr. Shubhra, you said, and I think somebody had asked that negative. So absolutely, in fact, if you have, those kind of things, please bring out. You don't have to be biased, as he said. And the other thing is, you also highlight if there are any controversies or if there is a gap in the literature. So that's what is going to build your case why you are doing this particular study. So I think that that's the importance of that good literature review. One more question is, Dr. Anil Reddy is asking, is thesis for DNB diploma candidates compulsory?
Absolutely. Absolutely, sir. You cannot give your exam. The diploma candidates cannot give their exam if their thesis is not submitted, sir. You cannot appear for the exam.
I think we've taken almost everything. Validation of the questionnaire, somebody had asked. So I think validation we'll have to, but very quickly, I think there are different validations, space validation, the content validation. So, but again, it will not be able, like, I think a subject which we can tackle in. But yes, what you could do is you can actually refer to some of this literature which is there, and you can involve, in fact, somebody who knows about it, even your statistician, because sometimes, again, depending on if it is like particular questions you have created new, so you can even have a validation of those, whether they are measuring the correctly what you intend to measure. So all those can be done. If the topic elaborate, can we write 20-25 pages a review of literature? Is it acceptable?
I think, yeah, I think it is better to stick to guidelines, Dr. Dasari. Yes, so 25 pages is probably not acceptable. I think
no, because
it is
the
not.
total thesis they say is 80 pages maximum if you see the guidelines.
Yeah. And see, let me tell you, your portion, which is going to take your maximum pages, are your results, whether we like it or not like it. So, results and discussion. This is going to take your maximum, 50% of your thesis will be results and discussion. So if you end up taking 25 pages for literature review, it is going to be very difficult, very difficult.
So we'll take the last question. I take this last question, Dr. Anil Reddy, how to choose a good topic, specific or broad one. Though we have tried to give you some hints on that, but Dr. Shubhra, anything you want to have? I've tried to share that in my part. So
I think it is a very difficult question to answer. I personally think it should be a finer topic. For fine means a feasible. It should be interesting to the investigator. It should be novel. It should be ethical, and it should be reasonable. So reasonable with respect to time, money, and person. So if you have a finer topic, then you have selected a good topic.
absolutely, Ali et al. So yes, I think on that note, I think we are already at 8 o'clock, and I think it's closing time. So I would like to sum up saying that we have tried to give you a brief overview. As Dr. Shubhro said, that 1.5 hours is not enough to do justice to all the things that we have to cover. But we have tried to give you a good glimpse, something like a thali where you have everything a bit and then you can sample it. But if you want to have more, I think probably, I think Ovid is also planning, and probably we will connect again. And I think I will let Ramya tell the plans, if at all, what are the plans, instead of me spilling the beans. But overall, I think we have tried to give you a glimpse of why research is important, why should thesis be there as part of DNB or MD, whatever. And then Dr. Shubhro has taken you through the different facets, including the ethical aspects, and also told you about how to go about writing each of these sections, including the introduction, the aim and objectives, the methodology, and also about the conclusion, the review of literature, and the annexures, very importantly. That shouldn't be missed at all. So I think with that, on that note, I think I would like to thank everyone for attending, and of course, Ovid and Wolters Kluwer for giving us this platform, Mr. Dinesh and Ramya for coordinating this. Thank you.
Thank you
you,
so much.
Ramya. Yeah.
Yeah. So thank you, Dr. Animesh and Dr. Shubhrajyoti. Thanks so much for giving this wonderful insights on thesis writing, and definitely we will plan for more sessions as you just suggested. And I would really like to thank all the participants for joining in and asking so many questions. Thanks for that. And if you have missed or couldn't attend this session for any reasons, you would soon receive our webinar recordings as well. And would request you all to please give your feedback. And if you may also suggest some topics if you need us to help on, or we will ask our speakers to plan these sessions on the topics which you suggest. So that's all from my side. Enjoy your weekend. Thank you so much, sir. Good night. Thank you, everyone.
Good night. Good night. Bye, Dr. Animesh. Bye.
Thank you. Bye. Bye. Thank you.